Hi folks, so today's topic is systemic lupus erythematosus. Questions that confused me on the previous exams, several exams. Okay, let's go, let's clarify confused questions, misunderstood maybe. So, about systemic lupus erythematosus, always if you find questions like this, you start always with definition. So, systemic SLE, systemic lupus erythematosus. Systemic lupus erythematosus, take your pens, papers and write please. What is this? It's a chronic multisystem inflammatory disorder of autoimmune etiology, occurring predominantly in young women. So why no idea? Anyway, manifestations may include arthralgias and arthritis, Raynaud syndrome, Meller and other rashes, pleuritis or pericarditis, renal or central nervous system so-called involvement, and autoimmune cytopenia. Diagnosis, my beloveds, is based on what? Requires clinical, of course, and serological criteria. Treatment of severe ongoing acute disease requires corticosteroids, hormones, and immunosuppressants. Next, I repeat it. So I don't know why you can get it. So it's an autoimmune nature. It's an autoimmune systemic disorder. It's multisystem involvement, SLE. So lupus is an autoimmune disease characterized by the production of autoantibodies. That's why it's autoimmune. They target body's own tissues, leading to inflammation and damage to multiple organs. What is clinical issue of that? What's the clinical importance? Understanding the multi-system involvement is crucial for recognizing diverse symptoms and preventing organ failure. But anyway, it's a systemic. That's why we have a diverse symptoms. Yes, and I repeat, it predominantly affects women. We can say that around 90% of all systemic lupus erythematosus cases occur in women, especially those of childbearing age. Clinical importance. Always consider systemic lupus erythematosus as a differential diagnosis in young women presenting with unexplained symptoms, especially joint pain and fatigue. About photosensitivity, my beloveds, photosensitivity is a key symptom. Up to half of patients experience photosensitivity, causing rashes and exacerbating symptoms upon the sun exposure. Clinical issue, counseling on sun protective and UV avoidance is crucial for minimizing flares. No, concerning lupus erythematosus, it's okay. Actually, sun protection, something. But anyway, concerning this lupus erythematosus, yes, counseling on sun protection. Classic butterfly rash, so the called Muller rash, butterfly shaped, across the cheeks and nose is a hallmark, but it's not present in all patients. In my life, fortunately or unfortunately, I've never seen this. I'll be honest. Of course, I'm not a rheumatologist, but I've never seen this hallmark. But anyway, early recognition of the rash can promptly timely diagnosis and treatment. About neuropsychiatric manifestations, yet they happened. Lupus can affect the central nervous system, causing symptoms like seizures, psychosis, or cognitive dysfunction. Clinical issue, be vigilant about neuropsychiatric changes as they may indicate disease progression or a severe flare. About cardiovascular risks, patients with lupus have a higher risk of cardiovascular diseases, including pericarditis, myocarditis, and accelerated atherosclerosis. It's an autoimmune systemic response. What is clinical importance? Regular cardiovascular assessment and management are essential to reduce morbidity and mortality. Mortality. Diagnostic challenges, ANA and anti-DS and DNA. What are they? So positive anti-nuclear antibodies, ANA, no acronym of course. Positive anti-nuclear antibody is found in over 95% of patients, but is not specific. Anti-dsDNA and anti-Smith antibody are more specific for lupus erythematosus. That's clinical issue of that. Interpretation of serological tests requires caution, as false positives can occur. About question, is treatment is multimodal? Yeah. Yes. Management often involves hormones, that is corticosteroids, hydroxychloroquine, I don't know actually how to pronounce, I suppose hydroxychloroquine or quine. Immunosuppressants and biologics like belimumab, but anyway, so the core it's corticosteroids, so biologic agents. Anyway, so clinical issue of that. Individualized treatment plans are necessary to balance disease control and minimize side effects. So answered in this manner. About renal involvement, so-called lupus nephritis. Lupus nephritis. Up to half of all patients develop this lupus nephritis, which can progress to renal failure if untreated. Clinical importance. Regular urinalysis and renal function monitoring are crucially for early detection and intervention. No possible intervention. So, about chronicity. Lupus, systemic lupus erythematosus, my beloveds, is characterized by periods of remission and exacerbations. Remission, exacerbation. What do we know about triggers? Stress, some types of infections, any infection, sunlight exposure, mentioned above, can trigger relapses. So we have to, the clinical importance, educating patients on lifestyle modifications and medication adherence helps maintain, we think so, long-term control. So stress, infections, illicit drugs, of course, smoking, sunlight can sunlight exposure can trigger relapses. Actually, we do not why, be honest. But you answer that relapse potential, stress, infections, sunlight. Psycho-emotional stress. So these all questions that I want to clarify, no principal misunderstood questions that I want to clarify. Good luck, God bless you on the big exams. Stay in touch. So don't forget to follow and subscribe my Dr. Y YouTube channel. Actually, don't forget to follow and subscribe my Telegram channel, Dr. Y. Dr. Y Telegram. So how to find this channel? Tap in the searching mode in Telegram. If you do not have Telegram, download this application, download on your phones, on your gadgets. So download Telegram. Then tap in searching mode of Telegram, Dr. Y. Dr. Y is me, like question, W-H-Y. Without question mark, of course. Dr. W-H-Y. Dr. Y. You click start and you choose your plan. You choose the cheapest one, up to you. Really, it's not costly at all. And then we will talk. You will find a lot of cheat sheets for the students, MCQ questions, MCQ tests and questions with explanations, all of them. What else? Your big oral exams, question answers, something like this. Presents, gifts, why not? Okay, stay blessed. See you on my Telegram channel, Dr. Y.